It's a great course. Hygienists and therapists are in demand. Hygienists are more in demand than therapists because there are much more roles for hygienists than there are for therapy. Every dental clinic has a hygienist. Not every single clinic has a therapist, but more and more are slowly starting to integrate them within the dental clinic. Hygienists can do less than what a therapist can do. Hygienists generally clean the teeth. They can also advise on preventing decay, preventing gum disease, how to manage your own oral hygiene at home, whilst also providing treatments like scaling treatments where you go for a clean. They can also do whitening, take impressions, and extra things like that. Whereas a therapist can do everything a hygienist can do, but more than that as well. They can also work with kids. A lot of the time they can do extractions on kids, they can do fillings on adults and children. They can even do root treatments on children. Therapists can do more, but therapists tend to earn less, but that is a whole other topic of conversation. But let's talk about whether it's a good career. Now, compared to dentistry, hygienists can actually earn more than NHS dentists, but they have less progression. So hygienists will typically start around £25-30 an hour, and then they can work their way up to around £40 per hour is very average for a hygienist, especially down south in the UK. Those who have expanded their clinical skill set and can do more and start doing more whitening treatments, they tend to be on the upper end of the scale at around £50-55 an hour, which is a very, very good, comfortable salary. Now, they work self-employed usually, or they can be paid hourly. But again, I'll make a separate video on how they get paid. Now, another thing to note is you also have flexibility and a good work-life balance as a hygienist or a therapist. A lot of jobs in the dental clinic are part-time. Now, some people might see that as a bad thing because they struggle to get a 5-day-a-week job at the same clinic. Most jobs are split between 2 clinics, so you'll do 2 days at one clinic, 3 days at another clinic. But to me, that's a benefit. If you can work 4 days a week and earn enough money and do the hours that you choose to do, that is a huge, huge benefit. And I think that is something that people need to consider when they're looking into a future career. Therapists, they earn less. They do earn less, and they have more stress, more responsibility because they're able to do more treatments. Being able to do things like extractions on children can be really, really fun for a lot of people who want to work with kids. But as you can imagine, anxious kids and taking out their teeth, giving injections, it's not fun. And those of you who've got kids know how difficult it is to take them for vaccinations and doctors and dentist appointments. And it can be extremely stressful. Now, with both careers, there are cons. There are cons where you find it mentally and physically taxing. It is really taxing on your body with repetitive strain injury in the wrist, backache, neck ache. You're putting yourself in a very awkward and uncomfortable position for like 8 hours a day. It can take a toll on your body. And I've seen as a dentist, it really does take a toll. Especially with hygienists, they tend to put them in the smallest room in the clinic, and there's not much space to maneuver around and be comfortable, and that can make it quite difficult. Another thing is you're very reliant on the clinic that you're working in to make sure that your diary is full with patients, and also it's being managed properly, reduce patient complaints, patients understand why they're paying privately for a hygiene appointment, things like that. It can be very difficult to manage patient demands. You need to have really, really good communication skills. And I think if you're not a people person, it's not the right job for you, and maybe consider something else. It's also very hands-on, so you're working with your hands in a very confined area. So you do need to have really good manual dexterity, so really good hand-eye coordination, and you need to be able to show that when you apply, and you're doing your personal statement applying to university. You need to be able to show that you've improved your hand skills, whether that's knitting, playing the piano, through art, arts and crafts. But in terms of career, it's still something I highly recommend, and I'm saying this as a dentist who's also taken up lots of locum hygienist shifts. When I have a day and I come in and I've got a full day of scaling, which is typically what the hygienist does, and it's not very often, but when I do have days like that, it's honestly such a relief for me. I know it's repetitive, but it's much less stress than doing crowns, fillings, bridges. Those kind of treatments, they're not for everyone. They are very technical procedures. And if you're picking between dentistry and dental hygiene or therapy, I do think about the type of person that you are. If you're a very ambitious person and you always want to be doing more, learning more, doing more cosmetic treatments, and you don't want to be limited in your role, then maybe dentistry is better for you. But if you're happy being on a comfortable salary, you're still learning on the job, you're always learning, you're meeting different people, and you don't mind that it is repetitive, hygiene and therapy might be a great option for you.